All right, everyone. I'm Dr. Scott Gray with Back in Motion Sport and Spine Physical Therapy of Fort Myers, and I'm here with my doctor and associate, Dr. Jonathan Gonzalez. And so, in this episode, we want to talk about what is the source of your lower back pain. So, in this quick video, we're going to basically talk about the different areas of the spine and lower back, particularly, that can cause pain. So, before we go into that, I think we need to discern and kind of tell you exactly what exactly is lower back pain, because a lot of people sometimes think they have lower back pain, but they don't actually have back pain. So lower back pain really should be from L1 to L5 of your spine. So L1 to L5 basically means that the different levels of your spine. So you've got 5 different vertebrae. So just like you've got a shoulder bone, a wrist bone, you've got spine bones called vertebrae, and in between these vertebrae you've got things called discs. And so typically you should have pain from that L1 to L5 area. You shouldn't have pain, above it. You shouldn't have pain below it, although sometimes it can refer into it. But in this case, that's the semantics as far as what determines exactly if you've got lower back pain. So now that we've kind of described, what lower back pain is, I thought we'd talk about some of the different pain source generators for people who've got back pain. So Dr. Gonzalez, why don't you talk a little bit about muscle? How muscles can cause back pain.
Yeah, so a lot of times, like we're doing here, we're sitting, whether it be at work, at school, and so when you're sitting down, it causes your low back muscles to kind of stretch. And so whether it be 30 minutes, an hour, multiple hours, day in and day out, those muscles are just constantly getting stretched and lengthened. And so those muscles, they've got receptors just like a lot of different tissues in our body, and they'll send signals to say, hey, this is not comfortable, we're bothered, we're in pain. And so that's a common thing we'll see is just postural muscular back pain.
Yeah, and to add on that, I think we'd also kind of see some weekend warriors and athletes who maybe they're playing a sport, or maybe they even bent over to pick up their grandkids incorrectly, to pick up a box, and they'll strain on their back muscles. So what are a couple of the common muscles that we see that typically get strained?
Yeah, so the erector spinae muscles or the multifidi muscles, those are commonly, they support your spine, and they're deeper muscles in your back that you might not necessarily see, but they hold your spine, and they're part of that corset of your core, and they commonly get strained when lifting or doing sporting events.
And another thing that we commonly see, so even though those might be the muscles that have been painful, sometimes you can even get spasm of other muscles that protect. And so a few of those would be the psoas and the quadratus lumborum. And those are muscles deep of the spine, and they really provide stability. And so sometimes you can get spasm of these type of muscles from a back strain or any other type of lower back pain generator. It's just a way to protect the spine. So let's talk about the joints of the spine. So the joints of the spine are called the facet joints. And so just like you've got, a shoulder joint here, you've got, wrist joints, you've got spine joints, and these are called the facets. And basically each segment of the spine has got about 4 different facet joints. So it can, it usually kind of tricks people in regards to they think they've got a muscle or disc injury perhaps, but in reality, a lot of times it's the facet joints. So Dr. Gonzalez, why don't you tell us a little bit about what type of symptoms people will have if they've got a facet joint injury?
Yeah, so a lot of times with certain movements of the population we see a lot is elderly folks, and when they're standing for too long, or they extend back or walking for long periods of time, they'll feel some facet pain. Sometimes in certain rotations or side bendings, they'll also feel that joint pain that just doesn't feel good, kind of feels like a dull ache or of sorts.
Yeah, absolutely. So as Dr. Gonzalez mentioned, it's people who've got facet joint pain, they typically feel worse standing, walking, when they arch their back backwards, or even if they rotate, that's going to compress these joints. And so typically we see is, as we age, arthritis of those joints, and those are typically the motions that will reproduce it. If you're an athlete or weekend warrior, you can also see a thing called synovitis or hemoarthrosis, which basically is a swelling of the joint. So whether it be you've stretched out the joint tissue too fast or you compressed it too quick, you can get kind of inflammation around the joint, and it'll be kind of problematic as well. So the next pain generating source we see commonly is ligaments. So our spine has a ton of different ligaments, and I'm not going to go in depth with them, but as Dr. Gonzalez alluded to, sitting is a common ligamentous pain injury. So people who work long hours and they're sitting at their desk kind of slouched, they're constantly pulling tension on their ligaments, and eventually we get a thing called creep. And creep is a kind of a deformation of the ligaments because they're under stress and load, and you can get some of that ligamentous pain. You can also have the ligaments strain from lifting improperly, twisting improperly, and etc. So that's kind of hand in hand with the muscle. But from an exam standpoint, what we would typically see is more muscle guarding potentially with a muscle strain, and ligament pain. You'll typically have pain when that ligament gets stretched. So that brings us to the next case here, which is nerve pain. So everyone wants to talk about the sciatic nerve. So Dr. Gonzalez, why don't you talk a little bit about the sciatic nerve?
Yeah, so nerve pain gets thrown out a lot to us. We see a lot of people saying, "Oh, it's my sciatic nerve," or "I've got sciatica," and it's just really important to remember that nerve pain is not as common as people think in the low back. And another thing is that there's some symptoms that are very, they tell us that it's nerve pain. It would be kind of like a numbness, a tingling, a constricting feeling in the lower extremities, in the legs. And it could be from the disc, it can be from arthritis, it can be from combination, but there's ways to be able to rule out that kind of pain. And so just because you have back pain, butt pain, leg pain, it doesn't automatically mean you've got sciatica. So it's important to visit a physical therapist so they can, in detail, look at your symptoms, look at your body, and see if you truly have sciatica, because it's just something that I feel like you hear almost every day with almost every patient, whether they have back pain or not.
Yeah, and I think there's a few different conditions that can mimic it, as Dr. Gonzalez alluded to. So a lot of times people think they have sciatica, they actually have a hip joint issue, because the hip joint is very vast and it's a deep joint, and sometimes you can get pain in the buttock area, and patients will think, "Oh, I got sciatica," but in reality it's actually potentially your hip joint. It also can be spinal stenosis, which is a little bit different than true sciatica, where it's actually being pinched at the vertebral bodies in the canal, where those nerves come out. And then you also can have a herniated disc, which can also compress the nerve, which makes you think you've got sciatica. But in reality, sciatica is a compression of the sciatic nerve after it leaves the spinal canal, and it's usually entrapped at the buttock muscle. And you'll have pain down the leg, which is similar to stenosis and a herniated disc, but the treatment options are completely different. So speaking of that, Dr. Gonzalez, what is a true presentation of someone who will have sciatica? What will typically make them better, what make them worse?
Yeah, so with sciatica, a lot of times bending forward would not feel comfortable. It kind of light them up like a Christmas tree, versus people with stenosis, bending forward might kind of feel better, make them feel good.
Yeah, that's a good point. Absolutely. And then another thing is people who typically have sciatica don't feel well sitting down, because it puts tension on the nervous system, but also compresses the piriformis muscle where the sciatic nerve runs. So the next pain generating source is the all-important disc, which everyone thinks that they have a herniated or bulging disc potentially. And so we always give this analogy here at Back in Motion that the disc is like a jelly donut. So the outside layer is hard, and that is called the annulus fibrosus, and the inside jelly part is called the nucleus pulposus. And the outside part of the disc, called the annulus, can be a pain generating source for patients who've got back pain. And so typically patients who've got disc pain will have pain when they bend forward for the most part of the time, and prolonged sitting as well. So maybe talk a little bit, Dr. Gonzalez, about what typically makes a disc patient feel better.
So usually the opposite of what Dr. Gray just mentioned. So if they're in pain, sitting, bending forward, it'd be the opposite. A lot of people hear extension-based exercises, things like that, standing, the cobra stretch, all these different extension-based exercises will help minimize the discomfort you get from a disc injury.
Now, a few other things I've got here written down is some different red flags potentially of patients who have back pain. They think it might be musculoskeletal, they might think it's a disc, ligament, muscle, or all the things we mentioned, but in reality, it's probably something more serious. And some of those things I've got written down here is cancer and a kidney infection. So typically with these type of patients, we'll have symptoms that don't really make sense. You might just have annoying pain, late at night when you're not doing anything. It'll come on at a certain time of day every time. You might have constant pain that's unrelenting. No positions seem to really avoid it. You might have a change in your bowel or bladder. You may even have some unexpected fatigue or weight loss. So if you've got some of those type of symptoms and that really haven't gotten better over a few week period of time, that's where you really want to make sure that you're getting, seeing your general practitioner and getting some further tests done, because you really want to rule those things out. And those are things usually we can rule out here in the clinic just by you telling your story, and we can kind of pinpoint exactly, okay, is it a red flag? If it isn't, and etc. So on that note as well, some other things that we can ask patients is, well, what makes it feel better? What makes it feel worse? If you tell us, standing hurts us, but sitting feels better, I can take you through a couple of different tests and discern, is it the facet joints? Is it just back tightness, etc. And so those are really the things that, as physical therapists and doctors of physical therapy that specialize in the spine, we can really kind of rule things out, but most importantly, fix the cause of your back pain. So there you have it, guys. Those are the sources of most lower back pain conditions. Remember, the first thing you need to do is clarify is, do you actually have lower back pain? Remember, it should be from that L1 to L5 area, and sometimes the lower back can refer pain into the leg, but majority, if you're having lower back pain, the conditions that you will commonly see as pain generators are your muscle, your facet joints, your ligaments, tendons, nerve, disc, and then obviously you want to rule out any red flags such as cancer, kidney infection, and etc. So I'm Dr. Scott Gray with Back in Motion, Sport and Spine Physical Therapy, and I'm here with my colleague, Dr. Gonzalez. And until next time, be sure to apply this information and call us if you have any questions.